the zanidatamab is very unique mechanism of action. So usually it's highly collected many cells, HER2-positive cells, because it's a bispecific antibody to bind in the two different domains of HER2. And that make cell clusters in the surface of the cancer cells, and that induces complement fixation. So different from usual antibody, which depend on ADCC and ADCP, this zanidatamab also has different immune effects through CDC. So that is very unique mechanism of action, and that is inducing immune desert type of gastric cancer to inflame the tumor type. So that makes the tislelizumab working better. So because of that, chemotherapy combination with the zanidatamab and the tislelizumab really improved the survival, and it's not related to the PD-L1 expression. So that will be very practical for the clinical practice without screening all those markers. So for the PD-L1 expression technology, has been tested in the different tests in the different trials. So because of that, some countries or the regulators only recommend the specific antibody, specific scoring method to the specific drug. But that is a really complicated situation, and we know that TAP score and the CPS is well correlated, and it's replaceable. So if regulatories are recommended and also approved, I think it's better to use TAP score, which might be more easier for the pathology to read. And also the benefit of TAP score is it can be used by the digital pathology for the future. So in that meaning, if you can get the approval from the regulatory body, I wanted to use the TAP score more. It's an interesting question. So that's important to control many heterogeneous clones in the first line. But the cancer has always a resistance in the end. So it's not easy to induce the CR for every patient with only one line of treatment. So that means the subsequent treatment is still important. But as we have more and more new HER2 targeting agents are coming, there is more potential to use subsequently. But still, if we can use that HER2 targeting agent and immune agent and cytotoxic agents, everything all together with a safe tolerability in the first line, it's the best to control all the tumors in the earlier period. So that makes the patient with a good quality of life and to maintaining for a long time. And if those patients are recurred and the progression of disease, in that case, we can think about the subsequent therapy.